Alrighty. Hi, everyone. Welcome to Amplify Women in Research. I'm very excited today to have Dr. Kristin Campbell with us. Dr. Kristin Campbell is here by popular demand, actually. She's a full professor in the Department of Physical Therapy at UBC in Canada. She has over 120 publications, with 33 of those having trainees as first authors, and her H-index is 33. So it's a fantastic, very impressive CV. Thanks for being here today, Dr. Campbell.
Oh, thanks so much for the invitation and for doing these.
Yeah, thanks. So it's always fun to start with telling a bit of backstory. So people love hearing these stories. Where did things start for you? Like, was there any one person or anything in particular that attracted you to the field?
Yeah, I always enjoyed exercise and I played sports a lot, as a kid and in high school. So I always really enjoyed exercise. And when I was in high school, we had to do grade 13 in those days. So I took OAC, which was what grade 13 was called, phys ed, which sounds, everyone laughed about that, like, ooh, advanced gym classes. But it really was where we learned about anatomy and physiology and all those sort of applied pieces of exercise. So I loved it. And so I think my high school yearbook will say that my aspiration for a career goal was to be the athletic trainer for the men's professional tennis tour. I loved exercise, I loved physiology, and I was going to physiotherapy, and that was sports. I wanted to work with athletes was my dream. I did go to physiotherapy straight out of high school in those days. I was lucky. And I did work with athletes through the university at Queen's University where I went. And I liked it. It was really fun and exciting. But I quickly realized that athletics was maybe not where I wanted to spend my time. I got a lot more out of some of the hands-on work we did as students with people in hospital and things like that. There was a lot of, I think you could see where you could have so much benefit for people that weren't already active. I spent a lot of time with the rugby team and they always had Charlie horses and split eyebrows open. And I'm like, there's only so much I can do for that. You're going to go and play again and get someone else's, shoulder rammed into your quad again. And so I really felt like it just sort of changed the direction of where I wanted to go more towards clinical exercise.
Yeah, it's so funny because you chat with students, undergrad students, and they're so interested in working with athletes, right? Because they see it as like these extreme sort of physiological limits and cool injuries or whatever. And then it's true, I think that it's the same story for so many of us. You start working with a clinical population and it's just so rewarding, right? But it's a lot of people start making that transition from athletes to clinical populations. So it's good to, like, I always try to get my students to do work with as many populations as you can, because you never know which one you're going to fall in love with, right?
I agree. And just keep your options open and try new things, and you never know.
Totally. So your expertise are in exercise and cancer, and your most cited paper is this huge consensus statement, right?
I don't know if that's the most cited one. I always thought it was a meta-analysis I did as a grad student with one of my colleagues. I think that's probably the one.
Oh, is it? Okay.
Cited. Yeah. So it literally was a meta-analysis we did in 2006 and with a colleague of mine, and it was one of the first meta-analyses of exercise trials looking at arm function and exercise after breast cancer surgery. And there weren't that many studies, but we were able to pull it all together. And because it was the first meta-analysis, it's been cited like over 500 times. I don't know that I'll ever have anything that's been that well cited ever again. So I think, not that you want to do only systematic reviews, that you want to get some original research done as well, but there is some value if you can find a review that it's becoming more and more difficult to find one that's a new niche or add something new to the literature because there's so many. But I think if you can ask a question and do a systematic review, it's really good learning experience to learn the methods, and they are surprisingly well cited if you get the right topic.
Yeah, and they're great for learning too, right? It forces you to read the literature and really be on top of it, because there's nothing worse than planning a study and then you go to the literature and you're like, oh, it's already been done, right? So if you actually are doing the systematic reviews carefully, then you find all that literature. So it's good for learning where the gaps are too.
Yeah, and looking at the quality of the studies and like, oh gosh, these aren't that great, and sort of understanding how you could make your research, improve your research so it does get better quality scores if it ends up in a meta-analysis. And you really have to start making tables and pulling all the research together. And so it really just highlights all the methods as well that you're like, oh, I wouldn't have done it that way, or that's a really good exclusion criteria I never thought of. So I agree. It's such great learning.
Yeah. You also sent me a paper with one of your trainees as the first author on it, on self-measured arm circumference in women with breast cancer. Did you want to talk a little bit about that one?
Yeah, definitely. That paper came out of a colleague of mine. We were trying to figure out how to improve physiotherapy access after breast cancer surgery for women in British Columbia or across Canada. And one thing that was coming out in the literature is if we followed people over time, it'd be really helpful because we could identify issues early, catch them earlier, and physiotherapy is more effective when it has not a well-entrenched condition. Does it make sense? So we thought we'll just bring people in at 3 months after their surgery, 6 months, and 9 months and 12 months, just to do a very standard physiotherapy assessment. And if there was an issue, we'd just be able to send them to physio. Because one of the main things is people just didn't know what was normal. And then if they had a problem, they didn't know where to go. So we thought we'd solve all those problems. And it did work. I mean, it was, we did a pilot study and people were interested and they liked the assessment. But one of my colleagues who works in stroke said to me, well, where's the innovation there? Could they measure themselves? And I thought, no, of course they can't measure themselves, can they? And one of the things we were looking for was early identification of lymphedema, which is a swelling in the arm after breast cancer surgery, commonly thought of if the lymph nodes in the armpit are disrupted either due to surgery or radiation, that sometimes is used to make sure that, to reduce the risk of the cancer spreading. And so as physiotherapists, we spend a lot of time learning the landmarking. We use very special tapes that we do circumference measurements at key landmarks across the arm. We use a special tape that has tension meters on it, so you put the same tension each time you measure. I mean, we spend a lot of time learning how to do this. And we said, there's no way women could be accurate themselves if we taught them how to do this. And so we thought, we'll try it out and we'll prove this person wrong. And so I had a wonderful grad student who was a physiotherapist from Denmark. Her name was Boletta Raffin. And she researched different ways to measure arm, and she came up with the body composition tape. So if you were wanting to measure your biceps after you've been at the gym for a bunch of time, so you just press a button and it kind of cinches up, which is what we were looking for. Because if you're measuring your one arm, it's very hard to do it with two hands. So she had this self-cinching tape. She just had people find, their wrist basically for very simple landmarking. She used a popsicle stick to measure out 10-centimeter distances. You just marked it. It was so simple. We made a little video. And what we found when we sent it to women is that women with lymphedema or at risk of lymphedema, they were accurate within themselves day to day. So good intra-rater reliability. Then they came to the lab and we measured them against a physiotherapist who had measured more arms than anyone in British Columbia combined. And so the inter-rater reliability was good because they were consistent between the expert physio and the person themselves. And then we measured them for validity of the woman's measurements against this thing called the barometer, which you stick your arm in and it goes over and it uses infrared light to really have an accurate measurement of circumference of the arm across the whole thing. So it's kind of the gold standard. And when we took the circumference measurements the women had and used this formula for converting it to a cone, their volume measurements for their arm were similar to this barometer. It was like, ICCs of, 0.95 or something. So women could measure themselves. And so we've really been trying to figure out how to leverage that to do kind of virtual self-management in collaboration potentially with a physiotherapy navigator or something along those lines. So we've been trying to work on the right trial design for that for the last 2 years. And of course, virtual now, this is, we're doing this in summer of 2020. So the COVID situation has really pushed us all towards figuring out virtual care models. And so I think the timing is good.
That's a fun story too, because it just goes to show why it's important to have conversations with people outside of your area of expertise, right? Like somebody kind of egged you on to do it almost, right? So that's awesome. And like you said, it'll end up being so much more useful in different ways, right? Because you forced yourself to innovate a bit there. That's awesome.
Yeah, definitely. No, it was a good push. And it's really been, with COVID, everyone's like, hey, we've heard you have this video. So we put it on our website and it's had tons of downloads and this little measurement sheet that people are downloading to capture their own arm circumference over time. So it's been really useful for physiotherapists as well. They're like, we need to do virtual telerehab. Like, can you give us these materials? So it's been great.
That's great. One of the other questions I sent you that you kind of highlighted as one that would be fun to answer is, if you could do it over again, would you pick a different area of research and why?
Yeah, that was a great question to think, would I take the same path over time and what would I do differently? And I don't think I would change too much, honestly. The one thing that I wish I had done more of is biochemistry and molecular biology. So, so I was going to say that didn't exist in my day, and of course it did, but there just wasn't as much ability to do arrays and look at genome-wide associations for things and microbiomes and all sorts of things. So I feel like on the cancer prevention and survivorship end of things, we're always wondering, like, exercise does improve physical function and quality of life, and those are fantastically important outcomes. But if you want to understand, well, what is exercise doing to reduce the risk of cancer or reduce the risk of cancer coming back, which in observational studies is well established, but what is it about activity that's so beneficial? And so because exercise is such a multi-system thing, it will take unpacking kind of this complex biology and all the systems approaches of when things going up and down to really kind of get a sense of what it is that's protective. And we want to know that to improve the dose, how much activity do you need to do to reduce the risk of certain cancer or the cancer coming back, or what, biology is happening that we can really understand what the prescription should be. So that's where I've been hampered by, my very basic, second year biochemistry knowledge. So that was the one thing that if I could go back in time, I would have done more of those sciences. But because I went into physiotherapy straight out of high school, we didn't have that opportunity. I didn't do an undergrad in anything other than physiotherapy.
Yeah, it's a tricky balance, because nowadays kids are so focused on getting good grades so that they can be competitive for physiotherapy or, be competitive for grad school and scholarships. But then you do lose out on knowledge base if you skip some of those harder courses, right? I'm in the exact same boat as you. Like, I'm trying to do more of the mechanistic stuff because you kind of need to know, or you want to be able to show some of the physiological changes. But it's really tricky when your understanding and skill set is a bit limited. So you collaborate, but it still could be better, right? If you knew the work a bit better.
Definitely. And I think that is the challenge. It's something as a PT department, we recognize that, if you're taking, calculus and molecular biology and organic chemistry, these are challenging undergrad courses. I mean, it's well established. And so, people are starting to shy away from those if they do want to go on to a professional degree. But yet that means such useful knowledge to have when we start even talking about the physiotherapy modalities we use, like ultrasound and laser, like what are they doing? And when we start talking about like what's happening and with the physics of it all, everyone's sort of looking at each other like, what? And even some of the pathology, like what's going on with some of these conditions. So, we're constantly aware of that, and we're trying to figure out ways to around that. So, I know it's a challenge. I don't want to say like, hey, everybody dig into those hard courses and sorry you didn't get to physio school 4 years later. I certainly don't want to say that. But I think being open to kind of challenging yourself a little bit and getting other skill sets is really important. So some encouragement down that road.
Yeah, for sure. So this is Amplify Women on Research, and so I wanted to give you an opportunity to amplify some women in your field that are sort of up and coming stars.
Yeah, I think the one thing that we're using the hashtag exercise oncology on Twitter, and I think that I would encourage anyone that's interested in this field or wants to see the contribution of women, follow that hashtag, because I really think that the next generation has a strong group of women who have really been contributing to this research. I feel like if I highlight some, I'll leave somebody out. But certainly, a lot of the grad students who have come through my lab, they've gone off to do amazing things. They're starting their own faculty appointments in terms of Amy Kirkham and Sarah Neal Stramko. They've gone on to do graduate work in other places like Australia, like Kelsey Bland has, and they're going on to physiotherapy school as well after they've done their master's with us. So I think there's a lot in exercise oncology just from my lab and beyond that, and I think that that hashtag really will bring you in with a lot of people. The other nice part with the exercise oncology hashtag as well is it's brought in clinicians as well. So we've had a lot of clinicians wanting to come and work with us as well, whether they're clinical exercise physiologists or physiotherapists. And so, someone like Sarah Weller, who's a kinesiologist in Canada, is very involved in CSEP as well. And Boletta Raffin, who's a physiotherapist who came to work with us, is now in Denmark. Came from Denmark, went back. So I think there's a lot that you can get from that particular hashtag, certainly. And I think, there's so many great mentors in this field as well. I think clinical exercise does generate, I think, more female PIs potentially than some of the other disciplines. And so I think I've been very fortunate along the way that it didn't seem like a new thing to be a woman in clinical exercise. Wasn't as maybe lonely potentially as it has been in maybe performance and sports science type venues. And so I think, I was just very fortunate all the way through that there were these mentors. But when I was reflecting about having this conversation, I thought during my PhD, who were my mentors? My supervisor was a male. But on my thesis committee was, a wonderful exercise endocrinologist. But then I realized she was the only female faculty in the exercise science or exercise physiology stream. I thought, oh yeah. I mean, she was amazing. And she was, I'd say, Vicky's so amazing. This is Vicky Harbour from University of Alberta. But I was like, oh, right, she was the only woman. I didn't occur to me until now. And then during my postdoc, I worked with an amazing group of women who were in epidemiology. And so that reminds me that public health has definitely been a place where there have been more women. And so I felt very fortunate to have the mentorship there. And it just was that field was very female dominated. So that was just interesting to start thinking about where those threads were and where I saw more representation.
Yeah, and it's definitely getting better, the representation piece, but it's true, like there are certain subdisciplines that are better than others. And so like I have to think really hard from my undergrad experience to think about women, especially on the physiology side. But then you're right, like the public health and the epi side, there's a lot more women mentors available. So it is interesting when you start reflecting on the different disciplines. Yeah.
And certainly I think that, you don't really recognize that other people are sort of seeing this who are coming up through in training as well. And certainly there's been conferences where one of my students turned to me and was like, why are there no women on the stage? And I had been to that conference for years and it just never occurred to me like that. It's just the way this conference is, but I never questioned it. And then after she said that, it was very obvious to me. So I think it's helpful now that I think our students and the next generation that are coming through are aware that this has been a challenge and that are really actively working to either, identify when they feel like potentially that diversity is not being well represented, whether it's women or, other individuals who have not traditionally had a place at the table in science. And I think this awareness has translated. I mean, there's conferences now. I just, ACSM, for example, when you put in a session now, it asks you, how diverse is your group of speakers for your symposium? Like, who are these people? And, are you working hard to try and find some voices that may not be traditionally represented? So I think those are great steps forward. And I think my generation, we just didn't, we just didn't recognize it, or we just didn't know that we could do anything different. But I think that's changing, which is amazing.
Yeah, I think it's funny. I think when I think back even to my experience, you kind of just go with the flow and you don't pay much attention to it because it wasn't being talked about as much in those days either. Not that it was that long ago, but long enough ago. And so because it wasn't being talked about as much, it wasn't on your radar as much, I guess. But now, I mean, I'm glad to see that students are even noticing it, so that hopefully will cause some shift and change, right? Because if it's on their radar, then they'll start demanding better. And I think they should, right? Like we owe it to make the field more inclusive, right?
100%. And it's not that people aren't out there either. So I think it just takes a little bit of like, hey, think, just spend like 5 more minutes thinking like, who else can I invite on this panel?
Yeah, totally. So with that, do you have any sort of words of wisdom or messages you'd like to share with early career research women coming up through the field?
Yeah, it's a great question. And I think one thing I just wanted to encourage people is to find a topic that you really enjoy. Sometimes when people are talking about grad school, they're like, oh, I think it might be a good idea. I'm like, no, you need to have, you really need to feel like there's something that you're really, really interested in. Because certainly for a PhD, it's a long, hard process. There's no way around it. And so, you got to pick a topic that you're passionate about and find the right fit for you with a supervisor and a place, because sometimes you can be lured by, the reputation of a particular place or things like that. But if it's not a fit with the topic area you're interested in, or the supervisor, it's just not the right fit, personality wise or in terms of work approaches, then it's going to be a challenge. So I think I would just encourage people as they're starting to go forward in this field, find a topic that you're really interested in and do some homework when you're looking for supervisors or places that you might want to do research. I mean, talk to their grad students and sort of understand like what their experience has been, and find the fit, because I think that will be improve your career way more than any other factor that beyond that. You really need a fit in a relationship with that person.
Yeah, absolutely.
Yeah, and I think, as a is that any different for women versus men? I don't think so. I think everyone should be doing that. And for women, I don't know. I had mentors. My supervisor for my master's and PhD were both men, and I got great experiences there. My postdoc mentor was a woman. I don't notice it was too much different. So I can't really comment on, how you would navigate that as a woman any differently. I think you need to find the fit, and that's the most important thing. I think the other piece is what we were just speaking about sort of being aware of sort of what's going on, and try and champion your colleagues. And I think that's where, maybe as a woman in this field, it is, making sure that you are trying to amplify as you're doing here. Like, who are the women in this field, and make sure they have the opportunities and have conversations with your colleagues about that. So I think that's really the important piece, is like, if there's an opportunity, like, hey, why not so-and-so for this? Because one of the main challenges I think are women are as ambitious and as qualified and, all the things you can think of, but, I don't want to make generalizations, but, I don't think we don't put ourselves forward sometimes because, we may have a whole lot of other things going on that we just, we don't want to take on some of these other things, or, it's not the first thing that we think of that we want to raise our profile. It didn't, you're in the nitty gritty of your day-to-day work. You're like, raising profile, like, is that an important piece of this too? And in some ways it is, just to make sure that the work you're doing and the trainees that you have get the recognition that they deserve. And I think sometimes we shy away from that, or it's just not a priority. And so I think when there is opportunities to sort of say, hey, like, let's think of ways we could make sure that all these other people we know that are doing great work are highlighted. I think women find it easier to do that for other women than they do for themselves. So I think that's a really key piece. Let's just keep our eyes open and create opportunities for each other, especially our colleagues.
That's actually really good. I like that, because it's true. Like, so many times like you said, you'll think of other people, and when somebody says, oh, we wanted to nominate you for something, you're like, oh no, I don't, like, it's just like you're overly humbled or something, right? Like, so I think it is important, because like you said, for your work and for your trainees to get the recognition they deserve, you do need to raise the profile. I mean, it's so competitive. There's so much being published. There's so much great work being done. And so you owe it to your work and to the participants and to the trainees to actually amplify their work. So I think that's really good advice. I love that.
Yeah, and it's just interesting, because I was in the last year I had the opportunity to go. I was eligible to go from associate professor to full professor, and I was like, like, does that change things any much? Not too much. Like, is this a priority? But then two other people in my department were going up, and I was like, well, if you guys are going, then I should go too. Like, I'm in the same boat as you. So I think if it hadn't been for that push, I'd probably been like, oh, I'll just do it next year. Like, it's not a high priority for me. But what it did, bring into focus for me was that, hey, like, these other people are more than happy to put their CVs forward now. So, like, why am I waiting? If we're all very similar in our career trajectory. So I think we need to push ourselves a little bit to take that step. Like, no, I am going to do it, even though it nearly killed me but at the time. But now in hindsight, it was a good move. So I think just being open to, if someone identifies an opportunity, like, think about it. Like, think, okay, yeah, maybe I should take this on, even if you're like, it wasn't your first priority in the first place. Just, take a step back and think, okay, this is a great opportunity, or it is the right time for some of these things, and I should, nudge myself forward.
I'm glad you did it because we need more full professors, right? That are
Well, that,
so
no,
good
it's true.
pushing forward, and congratulations. That's huge.
Oh, thank you.
Thank you so much for today. This has been great. Like I said, you were recommended by several people, so I'm glad we had the opportunity to sit down and chat. And hopefully, we'll see each other again in person. I'm not sure when that's going to be, but hopefully, in the next couple of years, we'll be able to sit down and have a chat in person.
Yeah, and thank you so much for doing this. I think it's really important for all the trainees coming along to hear these stories. As much as we think, oh, I don't have anything really to share. I think it's so great that you've given people the opportunity to hear these stories, because otherwise they may not.
Thank you, and they were fun stories. So thanks for sharing them. Bye.
All right, bye bye.